Okay, so today we're going to be demonstrating heart and lung auscultations and what conditions you'll use them for to screen for the sounds and what the abnormal sounds are. So first we're going to have a patient sitting here just as it is. First we're going to be doing heart sounds. So to find your heart sounds, what you'll be doing is you're going to be taking the bell of your stethoscope, take it between your two first fingers here, and then the first thing you're going to want to do here is you're going to want to find the second rib space between the second and third rib. So the first thing you'll do, you'll start on their right side. It's okay if I auscultate for some heart sounds. Okay. Get consent, and then you're going to palpate that spot here, listening for the pulmonic. And then you move over to the left side, right, same space. And then after that, you can go to Herb's point to your third and fourth spot. And then you go down one more spot for the fourth and fifth spot. And then the last spot will be right down here in the fifth space. Let's have a mitral valve. That's what we got for heart sounds.
So you're going to want to do heart sounds with the conditions of hypertension or history of hypertension, such as white coat syndrome, liable and primary hypertension, as well as atherosclerosis, coronary artery diseases, past infarctions, left or right-sided heart failure or history of that, as well as abnormal highs or lows of heart rate, and known murmurs and stenosis of the heart valves.
Okay. And then for lung sounds, we have 12 spots that we're using. This time we're going to be using the diaphragm of the stethoscope, so we're going to twist it around, and then let's get consent. Okay, if I listen for some lung sounds with you. So to find your first spot, we'll be working in kind of a diagonal zigzag pattern, which I'll explain along the way. The first spot, you're going to be starting on the patient's right side. You're going to go just right above their clavicle on the right side, and that'll be your first spot. And then from there, we'll move on to the right side, move down. I'll explain along the way. You find the clavicle here, right above there. Listen to a full breath cycle. And your second spot is the exact adjacent side. And then what you'll be doing is moving down about an inch with your stethoscope to listen for the next spot to get in between that first intercostal space. And then go into the opposite side, another inch down, opposite side again, down, opposite side again, down, opposite side again. And then once you get to your fifth, sixth intercostal spot, you'll start moving out to the side a little bit to get the last spots here. And then move here, down one more, and down to the other. And those are all the spots for auscultation with the lung sounds.
So with the lung sounds, you're going to have different sounds for each of the different conditions. So your restrictive conditions for the lung are going to be your pneumonia, your pulmonary fibrosis, your atelectasis, your ARDS, your interstitial lung disease, pleural effusion, and lung cancer. And then you're going to have your chronic obstructive pulmonary diseases, which is going to be your emphysema, chronic bronchitis, and your cystic fibrosis, and asthma.
Yep. And then good clinical practice is you do the anterior side, and the posterior side will be the exact same, starting on their left side, working down that same pattern through the intercostal spaces. And then best practice would be to also listen with the other side, the bell sound as well, for heart and lung sounds, just so you can clear out high and low pitches with different sounds.